Hi, it's Dr. Worden with Hopkins Family Med and Urgent Care, and today we are going to be speaking about the water-soluble vitamins, and this is going to be part 3 of the vitamin section of our micronutrition series. Thank you. Hi, it's Dr. Worden, and we're back to talk about the micronutrient section. We are going over the vitamins. And right now we're going to get into the part 3 section of the vitamins, which is the water-soluble vitamins. Part 1 has been on the concepts of vitamins. Part 2 was on the fat-soluble vitamins. And now we're going to get into the water-soluble vitamins. Okay. So, water-soluble vitamins will include the B complex along with the vitamin C. So the first vitamin we're going to be talking about today will be vitamin B1. Vitamin B1 is also called thiamine. Thiamine is a coenzyme that is needed to form energy from carbohydrate and from amino acid. So vitamin B1 helps with the metabolism of the carbs and the amino acid to form energy. Now, there are 2 deficiencies that I would like to speak about when it comes to the thiamine. One happens in alcoholics, and alcoholics are prone to deficiency either due to decreased intake or inability to absorb, as well as an increased demand in vitamin B1 or thiamine. And when that occurs, we get this deficiency that is known as Wernicke-Korsakoff syndrome. So this deficiency happens in alcoholics from deficiency of vitamin B1. There's also another deficiency that is called beriberi. And beriberi actually affects 2 different systems. One will be the nervous system and the other one will be the cardiovascular system. So there's 2 different forms of beriberi. And beriberi is a rare thiamine deficiency that occurs. Well, basically nowadays we have a lot of foods that are fortified, and that's probably one of the reasons why this is a rare thiamine deficiency. But when this beriberi occurs, it causes inflammation of our nervous system, and that beriberi is dry beriberi. When it affects the heart and the cardiovascular system, however, you can have heart failure from this. And that's called wet beriberi. So this can also lead to pain because of the nervous system, can lead to pain, confusion, and paralysis. So those are 2 deficiencies that I would like to discuss when it comes to the thiamine deficiency, which is vitamin B1. But you can find also, you should know that there are sources of plant-based foods that you can find thiamine in, and a lot of it is whole grains, quinoa, oats, barley. You can also find it in beans, squash, nutritional yeast. So these are examples of plant-based foods that carry a significant amount of vitamin B1. So the next vitamin we're going to go into is vitamin B2 or riboflavin. So let's get into it. Like thiamine, riboflavin is also a coenzyme for energy metabolism. It's a coenzyme for fat-soluble, for fats, carbohydrates, and protein. It's also needed for growth and development, but it is also needed for red blood cell formation. Deficiency in riboflavin is usually pretty rare. And again, it's because foods nowadays are fortified with these vitamins. But when you do have a deficiency, it's usually rare. And when it does occur, you can have mouth sores, you can have swollen tongue, inflamed and red skin. You can also have a rare form of anemia, believe it or not, from riboflavin or vitamin B2 deficiency. It's also important to note that this is one of the vitamins that's very photosensitive and can be destroyed by sunlight. You can also lose a good amount of riboflavin when you're cooking it, especially when you're boiling it. You can lose some of that riboflavin in just the water alone from boiling foods containing riboflavin. You can find riboflavin in spinach. You can also find it in beet greens. You can find it in nutritional yeast, and a lot of cereals are fortified with riboflavin. So it's pretty rare, but it can still occur. The next vitamin we're going to get into is niacin, and niacin is vitamin B3. This vitamin is very important for energy synthesis of glucose and fatty acids. People actually use, in the health field, we actually use niacin at therapeutic doses. We often use it to adjust cholesterol levels, like increase HDL and also to decrease triglyceride levels. So we use niacin at therapeutic doses for that. Niacin is also very important for the production of our DNA, and deficiency in this vitamin B3 or niacin, is called pellagra. And with pellagra, symptoms can include confusion, delusion, diarrhea, scaly skin sores. You can have inflamed mucous membranes. So this niacin is very important for these aspects. The next vitamin we're going to discuss is going to be vitamin B5. Vitamin B5 is pantothenic acid. Now this pantothenic acid, or vitamin B5, is needed to make blood cells. It is also needed to make coenzyme A, and coenzyme A plays a role in biochemical reactions like making and oxidizing fatty acid. Now, pantothenic acid helps release energy from carbohydrates by helping to make sugar or glucose, making and breaking down fatty acids, and it can also be said that it does the same thing for protein. Pantothenic acid helps to promote healthy skin, hair, eyes, our liver. So it is also very important vitamin. Now, deficiency in this vitamin causes burning feet syndrome. And what happens during burning feet syndrome? It basically causes distal paresthesia, so you can have numbness and tingling sensation in your extremities. You can also have GI distress from pantothenic acid deficiency. So these are things that I want you to keep in mind about pantothenic acid or vitamin B5. Now, let's get into vitamin B6. Vitamin B6 is pyridoxine, is pyridoxal, and is pyridoxamine. So these are all the different forms of compounds. These three compounds they are all converted into the active form of vitamin B6. And the active forms of vitamin B6 is pyridoxal phosphate and pyridoxamine. Like other B vitamins in the B complex, it's also coenzyme. And this coenzyme helps with amino acid metabolism. That's one of the main functions of this vitamin B6. It's also essential for red blood cell metabolism and for keeping red blood cell levels stable. This vitamin is required for optimal function of both the nervous system and the immune system. It also helps at adequate levels. It helps to protect against heart disease. You can find older people and people who are eating a poor diet that may have vitamin B6 deficiency. But vitamin B6 deficiency doesn't appear until later when intake has been low for an extended period of time. And when this happens, you can find skin inflammation, depression, confusion, seizure, and also microcytic anemia. So those things are very much important to know. I also want to mention that vitamin B6 deficiency can be seen in very common medications that we use, which are like, for example, isoniazid that we use for latent TB infection, or hydralazine that we use cardiovascular wise, like for example is used for blood pressure control, or even this levodopa carbidopa medication that we use for Parkinson's disease. So these are examples of medications that can affect our vitamin B6 levels. The next vitamin we're going to speak about on this complex is biotin. Biotin is also known as vitamin B7, vitamin B8, and it's also known as vitamin H. Like other vitamins that are part of the B complex, it is also a coenzyme, and it helps with glucose and fatty acid synthesis. Now, outside of that, it also helps with amino acid metabolism. Deficiency is generally very rare, but it can occur. And when that happens, you can have depression, hallucination, conjunctivitis, skin issues, hair loss, paresthesias. One thing that I must say, which many people know, is that when you eat raw eggs, it helps to impair the absorption of this biotin. And so we need to keep that in mind for people who are ingesting raw eggs, that it can affect their biotin levels. We can see biotin in egg yolk, soybean products, yeast, oat bran, oatmeal, almond, peanut butter, lentils, black-eyed beans, mushrooms, spinach. All these things have biotin in it. There's an important concept that I want to go over with biotin, and that is that biotin can affect thyroid labs, but it does not cause thyroid disease. But it affects thyroid labs. It can affect thyroid labs, but not cause thyroid disease. Now we're going to be moving on to vitamin B9. Vitamin B9 is also known as folate and folic acid, Now, folate or folic acid is needed to produce and maintain new cells. We need it to make DNA and RNA. Pregnant women are told that they should be using folic acid and they should be maintaining their folic acid levels. Why? Because without doing that, it has been known that you can have low birth weight babies. You can have premature birth defects, like neural tube defects. So pregnant women are told to maintain their folic acid levels, and they are at risk for developing deficiency. Outside of pregnant women, you can find this deficiency in people who eat a poor diet, excessive alcohol, and medications like anticonvulsants, which are used for seizures, and proton pump inhibitors, which is used for acid reflux and these type of things. So those are concepts that need to be remembered about the folate or folic acid, vitamin B9. It can also cause a megaloblastic anemia. You can see patients with this deficiency can have heart palpitation, headaches, shortness of breath, these type of things. They can also have difficulty with concentration and irritability as well. Tiredness, weakness, these things. Now, I should mention this. Excessive supplement, not food, but excessive supplement of folate has been associated with certain types of health risks or cancers. And that would be things like breast cancer, colorectal cancer, prostate cancer. People who also take excessive amount of supplements have been known to have increased childhood asthma and respiratory infections. But this, I should mention, is only with the supplements. It's not from natural folate found in foods. There's no health risk that has been associated with natural folate coming from, for example, leafy greens like veggies and beans and spinach, asparagus, collard greens, beets, lentils. It's not been associated with that. It's been, however, associated with supplement, folic acid supplements. So something to keep in mind as you are taking these supplements. If we go back to the concept or section 1 of our vitamins, I did discuss a little bit more in depth about supplements and us needing to recognize the fact that we need to look at it as medications, and we should be checking our levels before we go ahead and do that. Now, the last vitamin in the B complex that we need to discuss is vitamin B12. And vitamin B12 is cobalamin. Now, strictly plant-based eaters do not make, or for the most part do not get vitamin B12. Now, there are foods that are fortified with vitamin B12, and like example, nutritional yeast is also having some vitamin B12, but for the most part, strict plant-based eaters are the only ones that can get this vitamin from food or sunlight. So I will come back to this concept, but it's important to know the vitamin B12 assists with red blood cell formation. It's also part of neurological function and DNA creation. This vitamin B12 is made from microorganisms. Microorganisms like bacteria, fungi, and algae. So plants and animals don't make vitamin B12. They have to actually ingest the microorganism, the bacteria, or the fungi, or the algae. So that needs to be very clear. So when we eat animal products, we actually get vitamin B12 because those animals ingest the bacteria, the fungi, the algae. Strictly plant-based eaters can get that from fortified foods. They can get that from supplements. They can get that from nutritional yeast. But we do not get it directly. So that is a concept even for people who eat animal products. They actually have to eat the animal products to get that vitamin B12. And those animals are the ones that are eating the bacteria, the fungi, the algae that produces vitamin B12. So deficiency in B12 can lead to decreased sensation, dementia, difficulty walking, loss of bladder or bowel control, weakness. It can cause optic atrophy and depression. So a lot of this is related back to the fact that it assists in neurological function and DNA creation. You can get pernicious anemia from vitamin B12 deficiency. And like I said, as like folate, it is needed for the synthesis of red blood cells. So you can get anemia from deficiency of both folate, which is vitamin B9, and B12. Now, the last vitamin we're going to speak about, and the one that is outside of the B complex, is vitamin C. Now, vitamin C, like the fat-soluble vitamins that we discussed, vitamin E and vitamin A, is a powerful antioxidant. This vitamin is also important in protein metabolism. It is also important in immune function. It is important in iron absorption. It is also important to create collagen. Deficiency in this vitamin causes a rare condition called scurvy. And scurvy is rare because, like most foods today, we have a lot of stuff that is fortified with a lot of these vitamins. But when it does occur, you can have bleeding gums and reopening of previously healed wounds. You can find vitamin C in papaya, bell peppers like red bell peppers, guava, pineapple, broccoli, Brussels sprouts, kiwi, oranges, strawberries, cantaloupe, tomatoes. These are all examples of foods that you can find vitamin C in. So I just want to recap that today in this section, which is part 3 of the vitamins, we spoke about the water-soluble vitamins, and that include all of the B complex vitamins, which is vitamin B1 or thiamine, riboflavin, vitamin B2, niacin, vitamin B3, pantothenic acid, vitamin B5, and vitamin B6, as well as biotin, which is also vitamin B7, vitamin B8, vitamin H, also known as biotin, folate or folic acid, vitamin B9, vitamin B12, which is also cobalamin. So those are all part of the B complex vitamins. In addition to that, we also have our powerful antioxidant vitamin C. So this is what we've discussed today. Now this is just a lecture to go along with our blog. Our blog usually has detailed examples and all that stuff, including the daily recommended amount that we should be using for these vitamins. And the concepts are also very much detailed in our blog. So this is Dr. Warden. Thank you for listening. Please like and subscribe and check out the blog for more details on our vitamin section. Thank you.